Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. Ten minutes past 8 o'clock. It is Tuesday morning, the 5th day of March, 2024. Good morning, everybody. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air, of course, here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're anywhere else on the planet and want to listen in to what we're doing, just go to our website, of course, always streaming at ksje.com, or if you have one of those smart speakers, you can ask it to play KSJE, and if it's smart enough, it'll do it. Welcome also to our viewers who are joining us today. The program is streaming out live with video to the KSJE Facebook page and also to our YouTube channel. So we're so glad that you are all with us this morning. Coming up in the next few moments, it is our monthly check-in with the San Juan Health Council. And today, representing the Health Council is Capacity Builders. We'll learn more about what they do in the community and a big event coming up next month. Stay tuned for that conversation, which begins in the next few moments right here on KSJE. Then later on, of course, Mick Hess will take us roving with the arts. That's coming up after the news at 9:06 right here on KSJE. Of course, our 8:50 a.m., it's our Adopt a Pet Tuesday segment. We'll be checking in with Amber Francisco from the Farmington Regional Animal Shelter. She'll be introducing us to some of the pets that are available for adoption this week, including that handsome-looking cat on the screen right there. So stay tuned to learn more about him coming up in a few moments here on KSJE as well. Don't forget, you can also connect with us on X, formerly known as Twitter, and Instagram, in addition to Facebook and YouTube. And if you're a podcast person, you can subscribe for free to your KSJE podcasts, local programs that you may have missed on the radio. They're on places like iTunes and Spotify, Pandora, iHeartRadio, Google Podcasts. The list goes on and on, so check it out and maybe discover a new local program that you may have missed. Outside our studios here at San Juan College, it's a partly sunny morning this morning, 32 degrees at the moment. We're expecting a partly sunny day today with a high of 55 degrees in Farmington. Clear skies overnight with a low of 31. Tomorrow, mostly sunny skies on Wednesday with a high of 56. Partly sunny and 51 on Thursday. And take a look at Friday. Maybe a 40% chance of rain or snow showers with a high of 51 degrees and overnight lows, as you can see, in the mid to lower 30s. I'll be back with my guests from Capacity Builders right after this. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care. And back in Studio A this morning with my guests, as I mentioned, from Capacity Builders. Joining me here in Studio A this morning is Gloria Dee. Good morning, and thank you for coming in this morning. It's nice to have you here.
Good morning, Scott. Thank you.
You're very welcome. Also, Genise Denny is here as well from Capacity Builders. Genise, good morning to you. Welcome back to KSJE.
Yes, good morning, Scott.
Good to have you both here with me this morning. We were talking a bit before we came on the air this morning about how much growth we have seen with Capacity Builders over the years. And it really is a program that has really kind of grown and addresses a lot of needs and still tries to do even more. And that's kind of what we're talking about this morning with some of the programs and grants that you both are involved with. I wanted to start with a big one coming up, and that is in April, which is the National Drug Take-Back Day. It's a topic that we've talked about here on the air before with local law enforcement and just how important it is to properly dispose of unused or expired prescription drugs. And so Capacity Builders is going to play a role in that this year as well, correct?
Yes.
Tell me a little bit about what you're doing.
Well, currently, we've done the first take back last year in April. However, with some of the programs that we have in the Fort Defiance agency, we've planned to push it out even further across Navajo Nation. And with that, we are planning on having our take back in Window Rock and also Kayenta and Tuba City as well.
Very good. And it's important, I think, to get the word out to residents in those areas, right, of how they can safely turn in some of their expired drugs, because if not, they can get into the wrong hands and cause all kinds of problems, right?
Yes. So we established a committee where we are meeting on a biweekly basis, and right now we have a team, a really pretty good team, who are meeting consistently and talking about the plans and the initiatives of moving forward with the take back.
Right. Very good. And the official drug take back day is coming up on April 27th. And that's when law enforcement will kind of be prepared to accept some of these things in some of these locations that we're talking about.
Yes.
Got you. And they've committed to working with you to get the word out and being available for residents to drive up and safely dispose of their drugs like on that day?
Yes.
That's part of the plan.
Yes, and so we do have a representative from both states, from the state of New Mexico and also from the state of Arizona, who they coordinate with the tribal police and also are the ones who would do the pickup.
Very good. And are the times going to be coordinated at all the locations? Is that still something that you're working on? What can you tell us?
I believe that start time is like about from 9 to 2 o'clock.
9 to 2? Mm-hmm. Got you. And there'll be more information coming out as we get closer, I'm sure, to
Yes.
that April 27th date. But it's an important event. And I know here in San Juan County there'll be other events too, and the law enforcement taking part with this as well. But you're focusing on the reservation and working with the law enforcement authorities there.
Yes.
And that's an important thing. So great. Thank you very much for bringing that to our attention. Genise, I want to talk to you a little bit about some of the programs that you're involved with as well, and give us a little bit of an update on some of those things. What can you tell us?
Yeah, sure. Right now, we, like as Gloria said too, we also do National Drug Take Back Day, and our coverage for that is San Juan County and Shiprock area as well, and kind of going into the Navajo Nation area. We set up at Shiprock Chapter House for National Drug Take Back Day. We work in, we coordinate with Sergeant Goins, who is the San Juan County Drug Enforcement task. He runs that whole task force for us,
Right.
For San Juan County. So he has been gracious enough and helpful to come and coordinate that with us and pick up. He'll send out someone to pick up, and we have Navajo Nation police at our location to kind of be there, mediate, and do just to make sure that everything goes smoothly. So we do that on April 27th, and that is with the Rural Community Opioid Response Program. So that is the focus that I'm with today.
Mm-hmm.
So, yeah.
Very good. And so, as Gloria was mentioning, the locations in Arizona, you will have a location in Shiprock.
Yeah, we
correct?
cover Shiprock, and that is the New Mexico part of our side, yeah.
Right.
Yeah.
Very true. And I know in the past, and I imagine that will be the same this year, the Farmington Police and the San Juan County Sheriff's Office have also been working this event throughout the rest of San Juan County as well. Is that your understanding?
Yes. And actually, if you are curious about where you want to drop off, the DEA is who we work with as well.
Drug
And
Enforcement
we're
Administration.
Yeah. And we are in partnership to the El Paso sector. And they have on their website all the locations that is nearest to you that you can drop off. So if you're curious on where, if you're in Farmington, usually they have some at Walgreens. Just depends on where the initiative wants to take their group that day.
Right.
So,
Very
yeah.
good. Good advice. And I wanted to ask, and this is a question to both of you, and either one of you can answer, but just the importance of disposing of these prescription drugs, expired prescription drugs, or you no longer need them or whatever, instead of just having them still lying around the house. I mean, I think we hear stories all the time about people maybe getting in, if people have an addiction. Opioids is a big deal, and that's kind of the reason to get them out of the house and get them properly disposed of, and that's the reason behind events like this, right?
Yes.
Oh yes, most definitely. And in fact, our last drug prescription take back day, we had the biggest amount of opioids that came
Wow.
in. So it was actually pretty successful. So hopefully we're really hoping that this time around we have another successful Take Back Day.
Very good. Well, I hope you do, and come back and let us know how it goes. But even for the elderly and people like that who maybe have a lot of prescription drugs in their homes and they've done their purpose and gotten them better, maybe go through, if you're younger maybe, and can help them to properly dispose of these things and get them out of the house so that they don't fall into the wrong hands. I think that's really an important thing about events like this. But that's just one of the things that Capacity Builders is involved with. There is so much more, as we were talking about before we came on the air this morning. So talk to me a little bit about some of the other things that are coming up. I know there's a conference happening as well. We can talk about that and let folks know about this second annual Parent and Youth Caregiver Conference, which is happening in April as well.
Yes, so that is one of our initiatives with the Teenage Prevention Program. They have partnered with Central Consolidated School District, and they will be having their second annual Parent and Youth Caregiver Conference, which is coming up next month. And I believe that they are working together as a team with Central Consolidated School District and are getting their presenters, their workshops, and things that are all in the plan for our caregiver conference. The first annual was very successful, so they decided that we go with a second annual and just kind of keep it ongoing. And we've got parents, we got students who attended the conference. So I believe that there is flyers out. There's on our website, on Capacity Builders website, and also we are sharing the flyer with CCSD as well.
Sure. Very good. We're showing that on the screen for the video audience, but I just want to let our radio audience know this is scheduled for April 25th and 26th at the Farmington Civic Center, about 8 to 4. And if you want to go to our YouTube channel or our Facebook page and see the poster, there's a QR code that you can point your phone at, and it'll probably send you right to get registered, right, to sign up.
Yes.
That's how they work. Pretty cool about doing it that way. But there's also some contact information as well for some folks from either Capacity Builders or the Central School District who are presenting that with you. So that's great to know. So that's coming up again about the same time as the Drug Take Back Day, a couple of days before in April. It's all happening that week, it seems. But there's more coming up too, right? And so talk to me a bit about some other things. Genise, what else are you working with these days?
Sure. So like I said, I work with the Rural Community Opioid Response Program. So what that means is that we kind of go out, and our initiative is to work with rural communities in our area, also San Juan County. I do Narcan training for the community. I have opioid and fentanyl presentations that I do for the schools, even just businesses as well out there. Vaping is a big thing right now in elementary or high school and so forth, so I do that as well. We also have a mental health first aid training that we provide for the community. That is also available if you would like to partake in that. We have Annika Coleman, who is our mental health therapist at Capacity Builders. She conducts that training. So we have a wide range of different trainings and services, and that's part of our initiative with ARCorp, is to fulfill those gaps with the communities. If there is something that we can try to fulfill in the community, we figure it out, and we try to give that back to the community. We work with a consortium that we have created. It's called Four Corners Indigenous Health Consortium, and that focus is getting partners within the community. We work with San Juan County Partnership. We have built partnerships with people in the Navajo Nation, and that brings forth a lot of knowledge on their behalf. And but the partnership is to fulfill in those gaps, to see what is needed. And we also started a transportation service as well as we provide, and that is
Right.
for SUD and OUD patients that need to be transported to recovery services, whether that be at Senacor or at Tota Behavioral Health. We're trying to expand out towards the Gallup and Santa Fe areas. There's not many services here for recovery, so we're trying to fill those gaps by offering the services where they can get some help.
Right. Well, you mentioned so many things that I want to follow up with
Yeah.
you on about that. So thank you for
Okay.
that, because there's a lot. You started talking about the Narcan training, which I
Yes.
think is really important. We've seen a lot of those happening. I think a lot of folks are interested in learning more about Narcan, which is kind of the answer to the opioid crisis, and the idea being that if someone is having an overdose, someone could administer Narcan, and it can help reverse some of the effects of that. And if it's not an opioid overdose or something related to opioids, it does not cause any harm. At least that's my understanding of Narcan and just how revolutionary it is in these treatments.
Yes, it is. Exactly. Narcan will only treat fentanyl overdoses.
Fentanyl, pardon me. Yes,
yeah.
thank you.
And it will, if say there's a person who is ODing over methamphetamine and fentanyl, it would only reverse the fentanyl portion of the response to the body.
Right.
So, but it is very, very important to have Narcan on you as a person, you could save a life.
True, and it's done that. It's been documented
yes,
that it has
definitely.
been a life-saving administration. And so to train people on how to use it, how to administer it, when to have it, all those type of things, that's what you're talking about with this training that
exactly.
you're able to do.
And completion of the training, I give you Narcan to have. So it's very beneficial for you to have that training. And I'm so excited for the community response to actually want to take this training. So I've been to different organizations in Farmington area and expanding out to Navajo Nation as well. So I'm very, very excited to give that training.
It seems like there's a lot of folks who show up for these trainings when they are offered, because I think a lot of folks want to learn about that, and that's been a really good thing to see from the community.
Yes, and all our trainings are free.
And free, that's
Yes.
important to know. So great. And if folks are watching and listening to us this morning, would like to reach out to you and how to get on your schedule for a training, can they just call Capacity Builders or email you? What's the best way to do that?
Yeah, sure. All of our information is on the website. My number and my services are all advertised on Capacity Builders website.
Okay. And the website is capacitybuilders.info, I think,
Yes.
correct? Isn't that how it is? Yeah.
Yes, and follow us on Facebook too, because all of our information is on Facebook, and we have, like I said, that amazing flyer that you just showed. We keep it updated.
Sure.
Any services, opportunities that are going on events-wise that we are partaking in or co-sponsoring, anything, it's all on that Facebook page.
Very good. Good to know. Vaping is another thing you mentioned that I wanted to follow up with you on too, because you mentioned, I think, that vaping is being seen in kids younger and younger.
Oh, yeah.
I think I'd probably be shocked to know just how young maybe they are trying vaping and maybe not smoking. 6, 7 years old. That's second grade, isn't it?
Yes.
Okay. So, but that's what you're seeing and
Yes,
what you're
I do.
talking about.
Yes, and I go out to the communities, target a lot of elementary schools, little clubs, organizations, because it is a big thing right now for children and the youth. It's advertised for them. It's marketed to appeal to the younger group. You know, they have different flavors: cotton candy, fruit punch. You know, these little fun. You know, it's really easy to get a hold of too as well. So that's why I think the crowd is attracting for
Right.
vaping. So it's a big thing. And people have this misconception, like they think, oh, vaping is harmless. You know, it's a safe alternative to cigarettes. It's actually not. So, but
And that's the key, I guess, too, right?
Yeah.
Not to interrupt you, but I think that's really the key, because a lot of maybe younger people think, oh, it's safer than cigarettes because I'm not actually igniting anything. I'm just inhaling vapor. But it really does have some of the same types of harmful things that you're ingesting that cigarettes have.
oh yes, definitely. And you are with the vaping cartridges, you're not. The dosages, you're not going to be, you know, you're not going to measure that versus a pack of cigarettes. You know, you can measure it by the sticks, but the liquid inside is really hard to distinguish how much your nicotine you're taking in at one time. So it's really, and of course the chemicals inside too.
Right.
Yeah.
Right. And so you do a lot of work with that in educating
Yes.
people about what those harms may be and the dangers could be. And I think probably helping us all understand the marketing behind it, which does really
yeah.
kind of target younger and younger people, unfortunately.
Yes.
So good for you, and thank you. And I think that would take the cooperation of school districts too to allow you to come in maybe and talk to their students.
Oh,
right?
yes, definitely. And the more people that are involved and want this training, the better. Because it is beneficial to our babies out there, you know, the youth, and the more that they know, the better.
Right.
Yeah.
And it's great that Capacity Builders has all these relationships with the local schools to be able to take your message into and talk to the students about this.
Oh, yes, we're definitely grateful for the partnerships that we
Yeah,
have.
very good. Well, thank you for being here again this
Yes,
morning and
thank
for the
you.
work that you do. I know we're just touching the surface, but
Oh,
it's,
yeah.
It's a lot. So
Yes,
that's
definitely.
great. And speaking of a lot of work, Gloria Dee, I wanted to come back to you because you have been described as someone who covers and handles a lot of grants and a lot of programs with Capacity Builders, and that keeps you very busy. And somehow we tore you away this morning to come here to visit with me. But talk just briefly a little bit about some of the things that you're involved with, if you wouldn't mind.
Okay. One of the initiatives that I have is the Office for Victims of Crime, and that is a program that we do advocacy for. We train students and recruit students to become victim advocates in domestic violence, sexual assault, and I am always looking for students who are in an undergraduate program or a graduate program, or students even here at San Juan College or Denny College, or some of the schools within the Four Corners region. And we are here to have students get their feet wet in advocacy and kind of lead them in a direction where the importance of there shouldn't have to be any harm in the home or anywhere you're at, stalking, trafficking. Those are part of the things that we work in.
Right. And so these students, pardon me for interrupting, but I'm just to
That's
follow up
okay.
with you and just wanted to ask, these students get some great experience, it sounds like to me, and certainly learn some skills of helping these victims through, I guess, the system, the judicial process. Is that kind of what they're doing?
Yes. Say like they would go to an agency and work at an agency of their, where they feel comfortable of doing their advocacy work. And what they'll do is they'll share resources that are knowledgeable, say like protection orders. Some people don't realize that you can domesticate a tribal protection order off the Navajo reservation, like in the Farmington area,
Right.
Durango. So you can domesticate a protection order. And also there's resources shared where you could also help someone who is in need that is afraid to come forward, or they talk with individuals who are also survivors of domestic violence. And I think and then you talk to other people who are afraid to even say anything. And so those, you try to get out there in the community and work, with not only our youth, but also our young adults and our elderly population.
Very good. That's got to be a really important program, and great to see some of the work that your students and others are doing with these victims of crime.
Yes, and one thing that is unique is that we do pay for their trainings. We do pay for them to be nationally credentialed and get recognized as an advocate.
Okay, very good. So for a student, say here at San Juan College, or as you mentioned from Denny College or some of the other institutions of higher education, that's a pretty great thing to have on a resume, I would think, if you're going to move on or transfer to more college or get into the workforce or whatever the case may be, this type of training and credentialing that you're offering.
Yes, so I've got success students in the past who've moved forward in their life and are actually working with a victim assistance training program, or other programs that are victims advocates.
Very good. Well, thank you for the work that you do with that. I think that sounds fascinating. And what else do we want to share this morning about the other programs that you're involved with?
Okay, the other program I have is our Navajo Youth Builders Coalition. The coalition was established back in 2007, and so with that coalition, we do have the Drug-Free Communities program, and also we do have the Strategic Prevention Framework program, and also the Sober Truth on underage to stop underage drinking. And so those three particular programs all focus on substance abuse, misuse, and we have that focused target area within our Fort Defiance agency. However, this year we are there's so much demand, for some of our partners across Navajo Nation, where we are planning on pushing it out, Navajo Nation wide. We are going as far as maybe Loop, Arizona, where we have talking circles for our youth who are residents actually of Fort Defiance Agency, but stay in a residential area in the schools near Flagstaff. So we have a prevention specialist out there who's doing once a week talking circles with youth, about 40 to 60 students.
Wow.
Twice a week.
That's great. And this is in an area that's pretty rural, I would say,
Yes.
right? I mean, I must admit I've not been to Loop, Arizona, but I know where it is, and you really want to go there if you're going there. It's not something you pass through to get somewhere else either. So it's really important. And I think that also explains a bit of the reach of capacity builders and these programs. But it's not just in the more metro parts of northwest New Mexico. You are branching into Arizona, and all parts of the reservation, or at least a lot of parts of the eastern and central parts of the reservation, for sure.
Yes, definitely. So we are also, with our Drug-Free Communities program, our project coordinators reaching out to all of our 27 chapters in Fort Defiance region, and she is, making her visits at the chapters, doing an awareness of who we are, what we do, and, letting the community know that we have our substance abuse awareness and prevention education throughout Navajo Nation.
Nice. And is that working with the schools as well, or is that more individual groups and other entities?
Yes, with Winter Rock Unified School District and some of the schools surrounding within the Fort Defiance Agency, like Crystal Boarding School.
Right.
You've got a school maybe out in Delcon Community School. So we are we're just spreading out there.
Right. And that's great. And a lot of these programs are grant funded. These are things that you need to apply for and be approved for or awarded and things along that line, which I think, again, to the community shows that you're able to prove to these grantors the work that you're doing, the success rates that you're seeing, and that's why they are granting some of these funds and these programs for you to continue this really important work in these communities.
Yes. So one of the biggest things biggest project that we've been working on is on a youth-focused evidence-based curriculum, and it's called a Navajo Horse Journey Curriculum. And based on that curriculum, it'll be going before the Navajo Nation IRB for processing. And also we are looking forward to this 14-session curriculum, which entails a student handbook, a parent instruction book, like what kids. Parents are always curious about what are you going to teach my child.
Right, sure.
So we do have
information for them, I guess.
Yes.
Okay.
And then we have a facilitator's manual, and
this is about horses. And we're using horses.
It's like a metaphor
Yeah.
of a curriculum that we adapted from the Northwest Pacific tribe of the Suquamish tribes. And theirs was called the healing of the canoe, which they use that metaphor.
Okay.
But for us as Navajo, we don't live around water or anything. However, there is the horse, and the horse brings significant spiritual being about what if you were a horse, what color would you be? How would you carry yourself on forward in life? So, and there's traditional Navajo songs that entail of that.
Okay.
Out of the 14 sessions, it entails a lot about the Navajo way of life, your self-identity, your clanship, we touch up a little bit on suicide prevention, drug prevention. And so we are really looking forward to this curriculum, and we are have our partners with the Navajo Nation Medicine Men's Association, who are helping us guide this process, where we have a cultural advisory committee, and during those committee meetings we are ensuring that we are on target with getting the information out to our students.
Very good. And what is the grade level or age range of these students that you're hoping
9
to talk to?
9 to 17 years of age.
Okay. All right. So that's kind of high school age. And middle school age kids, I would say.
Yes.
So very good. Wonderful. Well, we are just about out of time this morning, everybody, but I really appreciate you both coming in to talk with me about all these events that are happening. Again, Capacity Builders, they have been growing since they got here, I think, and it's been great to see. Do a lot of work in a lot of rural places and a lot of important work in the communities here. Once again, the National Drug Take Back Day is happening on April 27th throughout the country, especially on the Navajo Reservation and in San Juan County. So please make yourselves aware of that and look for some of these old expired or you're done with them prescription drugs and have them safely disposed of, and some of the other events that we've talked about too. Again, the website capacitybuilders.info, and our Facebook is a place to get some great information about the upcoming events. So thank you both for coming in this morning. Great to have you here.
Yes,
Thank you.
You're very welcome. My guests this morning, Gloria Dee and Genise Denny from Capacity Builders, here with me on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.